So, in my experience with talking about sexual health and normalizing it in my annual exams, overwhelmingly patients have responded very positively. Sometimes it's just shock that I even brought it up and that this is worthy of conversation. Sometimes it is complete relief that somebody finally asked them about something that is bothering them their entire lives. Examples of that are women who have only known pain with sex their whole life and didn't realize that there was a provider who could make that better for them.
The response is having overwhelmingly positive. I think that most patients just have this big sigh of relief, just saying like, wow, thank you so much for asking that. Let me tell you, I've been so concerned about X or Y. And just even offering to speak or asking questions about sexual health can really open up the floodgates sometimes for a lot of those visits.
Patient outcomes can be improved by incorporating sexual health information and taking a good history in a variety of ways. It may be that the patient's being prescribed an SSRI for depression or anxiety, and they may have a sexual health side effect that they may not feel comfortable talking to their provider about. But if you can open up the dialogue, you can actually improve their care because you may need to make a change or an adjustment.
I usually say, hey, I'm gonna ask you some questions I ask all my patients. It's really important for me to know this part of your history so I can know how to best help you. But if you're not comfortable answering some of these questions, that is okay too.
I'm not asking to know your business necessarily. I need to know so that we can see if we need to, have testing, if we need to do further screening, whatever it is that we need to do to take care of your health and your body.
When I'm taking a sexual history, I oftentimes will start first with taking a history of more easy topics to discuss and opening a rapport with the patient before delving into the more difficult or sensitive topics. And then I try to normalize things by maybe saying, these are questions that I ask all of my patients.
So, creating a safe space to talk about sexual health is incredibly important, especially when we talk about trauma-informed care. We don't know what a lot of patients have been through. What's your body language? Are you facing the patient? Are you making eye contact? Are you showing that you're actively listening? Those are all the subtle things that I think can really make a patient feel comfortable enough to share intimate and sensitive information with you.
So in the typical course of a regular health visit, if a parent is with the patient, I usually would ask them to step out and say, this is the time for your child to discuss anything with their provider. Once the parent is out of the room, I say to the team, anything that we discuss in this room is confidential. So I ensure that they know that what we discuss will be kept private. So I think that's the first step in having patients feel comfortable in opening up and sharing this sensitive information.
I've had a few interactions where the patients were inquisitive. Why do you need to ask me that? Why do you need to know that? And that's where you have an opportunity to let them know, hey, it is part of your health history, it's part of your it's part of you being you. Part of the process is to let them know that if they're uncomfortable, we can just say, hey, it's okay. We don't have to talk about it right now. We can put a pin on it and then circle back to it later if we need to.
And if a patient does act offended or embarrassed, you can mirror the reaction you want to see in your patient. You show that it's not an embarrassing topic. You show them that there's nothing to be ashamed of, and you normalize the conversation. And maybe in the future, when they are ready to have that conversation, they'll come back to you because they know that there was no stigma talking about that with you.
I think that when patients bring up sexual practices that you may not be as familiar with, which there'll be times that will happen. So the first thing is to make sure that you're not giving away judgment through your facial expressions when a patient is sharing this very intimate part of themselves. I feel that asking from a place of inquisitiveness and curiosity to say, hey, I've never heard of that specific practice before. Would you mind telling me what it means or what it entails? Asking it this way will allow you to determine if this is something high risk that needs to be addressed further, or if there are specific preventive measures that you can take to help the patient be as safe as they can. There's been a couple of times in which I've been surprised with some practices that maybe I wasn't as familiar with. They've never shared that with anybody before, and they were actually very anxious to tell me. So I thank them for sharing this piece of information with me.
If the patient says something that you're not familiar with, just ask. They'll tell you. And you'll be surprised that patients are They may be embarrassed, but they may not be. But you won't know if you don't ask.
When it comes to sexual health, that taboo exists because it comes from a place of us not getting the correct training. And no provider feels comfortable talking about something they don't know anything about. And so it's not so much that we don't want as providers to address these issues with patients, we are ill prepared and not set up for success. And that's really why I think that providers are uncomfortable talking about those issues. As physicians, when we're training to become doctors, learning how to talk to patients is awkward at first, and the only way we get better at that is with practice. I forced myself to be uncomfortable. I put those questions in my template so that every single patient I saw was asked that.
So I've improved my comfort level by just doing it and then realizing what works for different families and patients when I'm seeing them and kind of getting an idea of where they're at and their comfort level. Some of the things I try to do is check myself at the door when I go into an office visit and realizing that every patient has their own experience, and that's going to be variable depending on where they live, their cultural background, their age, and who they may be there with for the appointment.
It has been a journey to learn how to take a proper, comprehensive sexual history, and it is something that is made from practice and perseverance. Initially, I've had a lot of interactions where patients were very uncomfortable and it was very visible, but I think the main reason that happened was because I was very uncomfortable asking those questions and was very awkwardly phrasing some of the things that I was asking. I think for many clinicians, the education piece can be really key in allowing us to be most comfortable asking these types of questions. I think learning different scripts, different methods, different approaches can be really, really helpful.
My advice to providers who are uncomfortable or unsure having these conversations with patients is first, maybe do it in a safe environment with somebody you trust and practice your history taking again, including those questions. If this is coming from a place where you feel like you don't have the fund of knowledge necessary to handle the answers that these patients might give you, find the resources and organizations that are here to teach you how to do that. And that patient encounter goes from being something you dread to something you look forward to.
Be ready to make mistakes, but also make sure that you're working with a script that you feel comfortable using and modifying as needed when you have a patient in front of you. I can guarantee you that you'll see a huge benefit in your practice and your relationship with your patients.